Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
Hi, I'm Elizabeth Holzschuh, the Director of Epidemiology at the Johnson County Department of Health and Environment. I want to talk a little bit about some information that we've heard from CDC around what people died with when they had COVID-19. There's been a lot of misinformation in the media and circulating around that only 6% of people who have died with COVID actually died from COVID. I want to dispel those myths right now. First, let me say that when somebody signs a death certificate, oftentimes it is about they died from pneumonia due to COVID-19. Or as an example, if I have diabetes and I'm attacked by a bear, and in the ICU, the doctors can't control my blood sugar and I end up dying, it's the bear that actually caused my death and not my diabetes. It's the same sort of thing when we talk about COVID. Somebody may have diabetes or have hypertension or some other pre-existing condition, and they would be okay. They would be doing well in their life and being able to live their life as they had been. But then they get COVID, and COVID causes the body to react in a different way and causes their death. So these death certificates that had other pre-existing conditions does not mean that this individual did not die from COVID. They likely would still be alive at this point had they not contracted this infection. Casey Moe looked at their data and found that in the last 5 years, 100%, every single one of their death certificates had 2 or more conditions listed as cause of death. So the fact that 6% of the death certificates with COVID-19 listed had no other pre-existing conditions, this is really shocking, but also reflects what we know about this disease. We know, and we've been saying for a long time, that people who die from COVID are more likely to die if they have these other conditions. Now, these individuals are people's loved ones, people's family members, and they were fine before COVID came into our communities and infected them. We all need to be vigilant. We all need to be working together to prevent the transmission of COVID so that nobody else has to die from this disease, whether or not they have a pre-existing condition or not.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.